I'm Dr. Sri. I'm a board certified family medicine and sports medicine doctor. In this video, we're going to discuss a topic that is very close to my heart: sudden cardiac arrest in athletes and how to save a person with a sudden cardiac arrest. So think about this. These athletes are all pretty healthy. They are exercising at a really high level, and for some reason, their heart stops functioning. Failure to recognize this can potentially cost a life. So please watch this video until the end and share with others so that we can spread the message. So without further ado, let's get started. So let's understand a little bit about our heart engine. So our heart beats between 50 to 90 beats per minute. However, this can vary a little bit depending on the individual. For example, my resting heart rate is around 55 beats per minute, whereas one of my friends who's an endurance athlete and his heart rate is around 45 beats per minute, whereas another person might have a resting heart rate of around like 95 beats per minute. So when we exercise or when we get stressed, our heart rate goes up, and that's just a normal response. So the heart contracts and relaxes. So when it contracts, it sends blood to all the organs and thereby it provides nourishment to the organs. And when the heart relaxes, it gets its own nourishment. So one key thing to understand is that our heart has its own electrical circuit and that works automatically to keep us alive. It's important that the heart electrical circuit pumps in a synchronous fashion and thereby it helps to keep the heart pumping. So when a sudden cardiac arrest happens, so basically what happens is that the heart stops functioning abruptly. So think about like let's say I'm driving a car and let's say suddenly my car's engine shuts off. That's exactly what happens in sudden cardiac arrest. And this can happen during exercise, before exercise, or even after exercise. So why this happens is sometimes we don't know. It could be due to a faulty electrical circuit, or it could be due to a fact that the blood clot basically goes and blocks the heart's blood supply, or it can be due to an abnormal heart structure that the person doesn't even know that he has. So basically all the conditions that we talked about creates an abnormal electrical rhythm called as the ventricular fibrillation. So think about the heart contracts and relaxes. So basically there is an electrical circuit that makes sure that the heart contracts in a proper manner. So when we say ventricular fibrillation, basically means that the heart's rhythm completely goes crazy. So instead of the heart contracting and relaxing, what it does is that it basically kind of still contracts, but it doesn't contract in a coordinated fashion. And thereby this basically, even though there is electrical activity inside the heart, but still the heart has stopped functioning completely. So the key thing to understand is that this happens abruptly. So it's almost like we talked about where I'm driving a car and then the car's engine shuts off. That's exactly what happens. It's like a person is fine and suddenly it's almost like a switch off, the heart stops functioning. So let's watch some clips of sudden cardiac arrest to understand this further. So in the first video clip here, so you can see this person gets hit on the chest and within a few seconds he grabs his chest and he loses consciousness. The bystander should be able to recognize this, that this person has had a sudden cardiac arrest. So basically this is a condition called as the commotio cordis, and here the impact generated the abnormal electrical rhythm called the ventricular fibrillation and thereby creating the sudden cardiac arrest. So in this particular clip here, you can see this baseball player, he just falls to the ground. He's been playing fine and suddenly, as I said, it's almost like a switch off and he developed a sudden cardiac arrest, thereby collapsing. So in this particular clip here, you can see the basketball athlete, he's suddenly collapsing without any protective response. So no one would fall like this, right? So again, as I said, it's almost like switch off, sudden cardiac arrest happens, and then he falls to the ground. So what we know so far is that this can happen abruptly. So basically he'll be talking fine, he'll be playing fine, and suddenly he collapses. This is key to recognize so that immediately you as a bystander recognize this, or this is sudden cardiac arrest, I should start doing things that I'm going to teach you right now to save his life. So I've got a great team here. So I have a great medical staff that is taking care of my athletes so that when this happens, we are ready to save a person's life. But unfortunately, not every school or not every game might have a medical staff, which means that you will be the person who can save someone's life. So let's say a person has a sudden cardiac arrest. So he's going to fall onto the ground. He can either lie motionless or he can sometimes have a seizure-like activity. So anyway, we know that this person has an underlying abnormal electrical rhythm called the ventricular fibrillation. In order to revive this person, we need to deliver a shock so that we can convert this ventricular fibrillation rhythm to a normal rhythm. Unfortunately, that takes time. So let us say if someone has an AED in school, then we can get the AED and can deliver the shock right away, but still it takes time to get the AED. But let's say if you don't have any resources, then you have to call the emergency medical services, and again that is going to take time for them to reach here to provide the shock. So in the meantime, our only goal is to make sure that we manually contract the heart so that we keep the heart alive. So far you've suspected that this person has a sudden cardiac arrest. How do you confirm that this person has a sudden cardiac arrest? So the first step is that you're trying to wake him up and see if he's responding. If he's not responding, then that's a red flag. Again, you're worried about sudden cardiac arrest. The next step is to check for breathing. So either the person will have a completely absent breathing, or they can have abnormal breathing, or they can have normal breathing. So an abnormal breathing is basically where instead of having a proper chest expansion and relaxation, they'll have flickering of movements, and again that is considered as red flag, and then you have to consider this as a sudden cardiac arrest. And the last step is to make sure that you check the pulse. I usually would recommend checking the carotid pulse. So carotid pulse is going to be like right here. So basically this is your windpipe here. You take two fingers and you're going to put your two fingers right adjacent to the windpipe here, and you're going to put a little bit of pressure. And once you put some pressure, you'll feel the pulsations. And you're going to check the pulse for 10 seconds. And if you don't feel a pulse, then call 911. So once you've done that, it's time for chest compressions. So chest compressions is the most important thing to keep the heart alive. Rescue breaths are not necessary unless you're trained to do so. So basically what you're going to do, you're going to clasp your hand like this, and then using the palm of the hand, it's going to come right at the center of the chest. So basically right where the two rib gauges meet in the center. You put your hand right around that center of the chest. You're going to keep your elbow straight. You should not lean onto the patient. So basically you're going to stay like that, and then you're going to provide compression and relaxation. So compression and relaxation. So you're going to aim for chest compressions around like 100 to 120 beats per minute. So let's look at this clip here. The compressions are performed correctly. So the hand is placed in the center of the chest, the elbows are straight, and with enough force. So remember what we're trying to do is that we're trying to mimic the heart's function by manually contracting it so that thereby the blood flows to the organs, and then you release the compression so that the heart can get its own blood flow. So how hard should you compress? So aim for at least 2 inches or 5 centimeters above the length of your little finger. The rib fractures may occur, but don't worry, they can be treated. So one of the common mistakes that I've seen people doing when they do CPR is that they lean onto the person, and thereby they're not letting the chest to recoil back. So remember, when the chest recoils, that's when the heart gets its own nourishment. So you want to make sure that you compress the chest and then let it recoil so that the heart can get its nourishment so that you can keep the heart alive. So once you start chest compressions, continue until the EMS arrives. Do not give up. So if you have a bystander, tell them to just watch what you're doing, and then when you get tired, let them take over. Again, once they get tired, you start helping them. So just continue doing this until the EMS arrives. So once the EMS arrives, they can deliver shock using a defibrillator to potentially revive the person. But remember, the reason the shock was successful is because you kept the heart alive through continuous chest compressions. Let's do a quick recap of what we have talked so far. So when you encounter a sudden cardiac arrest situation, the first thing that you'll do is check for response. If no response, then check for abnormal breathing or the absence of chest movement. If that's negative, check for a pulse for no more than 10 seconds. If that is also negative, then call 911 and begin chest compressions. Remember, keep the hands in the center of the chest, straight elbows, and push hard and fast. Keep doing this until the EMS arrives. If you need help, ask a bystander to assist you. Thank you so much for watching this video. I hope this video has prepared you to save someone's life. So if you have a pillow at home, just practice with the pillow so that you can be prepared when the time comes, okay? The only favor that I'm going to ask you is that if you find this video helpful, please make sure that you hit the like button and please share this with your friends. Thank you so much for watching, and I'll see you in my next video. Until then, goodbye.